Hello and welcome to Herbalist and Herbs. My name is Chrissakis. Today's video short, how diabetes and insulin resistance feed cancer. Now I've spoken about these two subjects independently, but I want to bring them together and I want to show how much of an influence diabetes and or insulin resistance can be in terms of creating the foundation for cancer and also pushing cancer once it's established in the body. Now, the thing about diabetes and insulin resistance is that it's the absolute perfect partner for cancer's desires and the things it needs. That is, diabetes and insulin resistance induce oxidative damage, which cancer likes to use for mutation. It induces elevated amounts of glucose, which of course cancer wants to use for the purposes of expanding itself and multiplying, as well as for fuel. It also induces free radical damage on everything because we raise the oxidative level due to both insulin resistance and excess glucose. There are other factors that go into it. Another one is that the inclination under diabetes and insulin resistance is to coagulate and thicken blood, which cancer likes a lot in order to form tumors, in order to metastasize as well. So also in thickened blood is also rich in growth factors as well as inflamed tissue. So cancer really likes both the process of inflammation, hypercoagulation, excessive oxidative damage, and all these things are supplied by diabetes and insulin resistance. So let's go into, first of all, the numbers. The combined number of people that have diabetes and or insulin resistance is about 100 million people. That's about a third of our country. Now, the fact that because of the processes that I just spoke about, it acts as a foundation for many things, including heart disease, but we're going to go specifically into cancer. So, we mentioned before that in order to, how does excess glucose, which is the result of either having diabetes or insulin resistance, excess glucose in our bloodstream affect cancer? Well, when we are insulin resistant or have diabetes, our normal cells resist the entrance of insulin, which delivers glucose into the cell. That's insulin resistance and diabetes at the cellular level. And what happens is that raises the blood serum level of glucose. Now, cancer cells never become insulin resistant. As a matter of fact, they put up 10 to 12 times the insulin receptors in order to get much more of the excess sugar pumped into them for use as fuel and also to help cell division. That's one thing about glucose. Another thing is that glucose binds to the red blood cell hemoglobin, and you can measure that with an HbA1c, and that's a definitive marker for diabetes. The number that it's matched at 5.6, in my opinion, is too higher because all the things that are going on in type 2 diabetes in terms of damage to our bodies is also happening in insulin resistance. So, you have glucose binding to the red blood cells and damaging them. You also have it binding to free amino acids. And when it does, it forms something called advanced glycated end products. Those are called AGEs. Now, AGEs are very hard for our body to get rid of. They're damaged protein structures, and they produce a lot of free radicals. Once again, cancer likes an environment that has just enough free radicals going on to help it to mutate and become stronger. So it uses this field that's being created by diabetes and insulin resistance to further its end. So let's go into insulin. Now, insulin upregulates inflammatory processes. Once again, this is a primary thing that cancer needs to get where it wants to go. It needs the process of inflammation. It also tries to induce it. But if you've got insulin, high insulin in you, that's already enough to begin the process of systemic inflammation. Now, when you raise inflammatory levels, you accelerate two major cascades that are both within the cell and outside the cell, and cancer applies itself to both of those things. Excess insulin also upregulates the formation of estrogen from androgens. This is a problem in men, especially an unrecognized one in terms of the influence on prostate cancer. That estrogen becomes a driver that's being formed in the fat tissue from the conversion of testosterone into estrogen. And this, again, is accelerated under the influence of insulin. Now, insulin also has a major effect in other areas, especially thickening of the blood. It raises platelet level and platelet aggregation level, as well as raising fibrin levels in the blood. And fibrin is part of what we use for wound healing, but is integral to cancer, especially in the spread and angiogenic processes. That is, when it's building collateral veins or metastasizing. So when a person gets diagnosed with cancer and they have insulin resistance and or diabetes as the background, as a pre-existing condition, their prognosis is already compromised. And also, it's not taken seriously enough, generally in treatment protocols. So again, when I work with people, those are some of the first places I go to try and normalize to the best degree that I can their insulin and their glucose levels, because it's so damaging to their body normally, and it's also accelerating the cancer. If you want to know more about either one of these subjects, that is cancer or diabetes or insulin resistance, please go to my website, which is herbalistandherbs.com. Thanks for taking the time to watch this video.